April Cook, Section 2, Term 2, Adult Health 1. I am going to simulate administering IV medication via a mini bag. For my patient, I have checked the physician order. The physician has ordered Flagyl. This patient has no allergies to food or medication and is here for an infection. Flagyl is an antibiotic, and so this medication makes sense for my patient. And I have verified labs and the CBC, the BUN and creatinine, and in the CBC, the WBC white blood count. So this patient needs this medication, and so I am going to be administering that via a mini bag through an IV that's already been established today. Let me think. For my medication, Flagyl has been ordered. This is an anti-infective antiprotozoal. The action is disrupts DNA and protein synthesis in susceptible organisms. The purpose is to treatment of anaerobic infections. This recommended dose is 15 milligrams per kilogram initially, and then 7.5 milligrams per kilogram. Some side effects are dizziness, seizures, headaches, dry mouth, encephalopathy, apical neuropathy, abdominal pain, nausea, vomiting.
Alright, so that was just trying to get the order down.
And then you would concentrate on hypersensitivity, caution, and you can look for a history if they have a history of blood dyscrasia. Alright, what I'm going to do is the medication that has been ordered was 500 milligrams. The pharmacy has sent me a vial that reads 250 milligrams per ml, and my order is 500 milligrams. So I will be drawing up 2 mLs of 250 to equal 500 milligrams. I'm going to insert that into my 100 ml mini bag and hook it up with my tubing over an hour for my patient. Initially, what I'm going to do is, this is my vial of Flagyl that I received from the pharmacy. I'm going to go ahead and clean the tip to keep aseptic technique. And I am going to draw up 2 mLs, pull back, I'm going to inject my ear, pull back, yep, I have my 2 mLs, and then I am going to, this is a sterile bag, I'm going to pop off my cap and inject my 2 mLs in my mini bag. This is now, and this also can be done with a needleless blunt tip cannula. Now I am going to mix this in, make sure it's thoroughly in there. Also, over 1 hour, that's going to equal 17 drops per minute. I am going to label this with my client's name, drug, the dosage, the time that I'm administering it, and my initials. Now what I need to do in order to connect this mini bag to my patient's IV, I'm going to have to get my primary tubing, which I have here, and this is also sterile right out of the package. I'm going to keep this sterile where nothing can touch it, but I will disinfect the site again since it's hitting room air. Alright, I'm taking this out of my bag, out of the package. Alright, I'm going to need to prime my tubing. I'm going to go ahead, remove my cap, this is sterile, go ahead and sterilize my mini bag. I'm going to squeeze, inject it, flip it over, go ahead and move it, prime my tubing. I'm going to have to unkink with the clamp. I'm unkinking, and I'll know my tubing is primed once I see,
Just a quick run through.
once I see the solution come over, and this will be, water will come here. I don't remove this until I go into the patient's room. Alright? Okay, it's primed. Now what I need to do is I need to label my tubing with my initials, the date and time, because this tubing can be used again within the correct time parameters. Okay? And I also have a label on my medication so that I know that I have the right patient, the right dose, the time, and I'm going to go ahead and go into my patient's room now. Alright, I'm going to walk into my patient's room.
Hang it.
Hang it up. While I'm holding this, I'm going to hang this here.
It's going to be
I'm
hang.
going
I'm going to hang it here. Go ahead.
push
This is still sterile
aspirate.
because it has no, I have not removed my cap yet. I'm going to wash wash my
I'm
hands,
going to aspirate.
apply my gloves.
And I see blood.
I'm going to
And I
check the
see blood.
patency
I'm going
of
to
my client's
push,
IV.
stop, push,
I have
stop,
already
push, stop, push,
Drawn
stop.
up 6
A
mLs
last push.
of medication
I'm going
that,
to
excuse me,
clamp
not
it off. At
medication,
this
of
point,
normal
I've done
saline that I'm going to go
the
ahead
ASASH,
and flush.
aspirated
I'm going to flush 3
saline,
mLs
administer
to make sure the
saline. I
patency
do not
of
have
this
to
is
do the
correct. I've
heparin because
assessed
you only do
there's
that with
no
PICC line or
pain,
suture
swelling,
line.
patient hasn't had any complaints. So now
You put
I am
my
going
bottom
to
line.
PICC line
take
or
my
central line, or if there's
alcohol.
one which there's not,
I'm going to
so
clean
then
off the
into
hub.
H part of the
First I'm
ASASH.
going to do the
Um,
ASASH where I'm going to aspirate,
I would
pull back.
dispose of this.
I have blood. Now I'm going to do stop,
I'm
go,
going
stop,
to
go, stop,
take
go.
my
I'm going to push
patient's
this in.
IV, also
You-
noting that
and
again
then,
there
so now
is
it works.
no heat,
That was
no
3
redness, no
mLs.
swelling,
Now what I'm going to do is I'm going to hang
pain.
on to it.
Um,
I'm going to keep the other 3 for when I'm disconnecting.
alligator clamp
And then I'm going to remove my tubing. disconnect my tube. Now I'm ready to start my patient's medication.
Old one and put a new alligator clamp on it for the next person. That's something Seat does, yeah? She said
Alright,
sterilize it.
this is still sterile, and I've already cleaned my port. Now I'm
Well, I
going
would do that like right when
to connect my port.
You don't have to either way.
My clamp is
'Cause
already
you're
unclamped
tossing
from when
the
I have
old
already flushed the 3 ml, so it's already
putting on a
unclamped.
new
So
alligator
now,
clamp for it.
I've got it connected,
So
but
when
now
I
I need to
unscrew
set
this,
my drip
I'm
rate,
just gonna
which for
add
my
the
medication I
clamp
work
it into the-
17
Yeah, you're gonna say,
drops
so
per
there's an
minute.
old one
That
put
goes
on
to
a
about
new alligator
4
clamp for the
drops
next person,
per
and going
second.
about your business.
So then what I'm going to do is I'm going to
and then
take my
That's it,
my
right?
clamp, go ahead and roll it, make sure my medication is coming
What are you
down,
gonna document?
and I'm
I'm
going to
going
count.
to document
as I
the
hold.
time, the drug and the route,
Okay. Now I have it running at 4 minutes per second, which means it's
dose,
17 minutes per minute. Excuse me, 17 drops per minute. So now that I know
document
that this
any
100
intakes,
mLs with
outputs,
2 mLs of
or
the
any
medication will
IOs.
infuse over 1
I'm
hour.
going to note the
I'm gonna
condition
come
of the
back in
IV
15
site,
minutes
it's good to go.
And my
and
definite
reassess.
eye is gonna be
It's going
100
in.
milliliters.
There's no infiltration. When I flushed and pulled back, it aspirated good, so I know that
That's
everything
what
is
your
okay
eye
here.
is.
I know, but
And my tape is in place. The IV is secure. Nothing. The client knows that there's no pain addendum. The client has been educated on what he's receiving. He is receiving Flagyl, which is an antibiotic. So Mr. Jones is aware of that. I inform my patient that I will be back in 10 to 15 minutes to reassess.
At this point,
Okay, an hour has passed. Now I come back in. My mini bag is empty. The medication has come in. I still have 3 mLs left of my normal saline. I am going to disconnect from the. I'm gonna clamp it at this moment right now. I'm going to disconnect.
you've checked on them periodically throughout the. It's 60 minutes later, the
Okay,
bag's
I've
empty, and you
disconnected.
check on them periodically.
I'm gonna put an alligator clamp on here so this tubing can be used again. Go ahead and hang
at
this
this
here.
point, I am
Alright,
back in my
I still have 3
patient's
mLs from
room.
the 6 ml that I drew up. Now I'm
We've
gonna
already
flush
discontinued
the
IV. I've
additional
been
3
back
mLs.
periodically to check on
I'm
him,
gonna
make
clean
sure
my hub
everything is
again.
fine with his IV.
Alright,
I'm going to
and go ahead.
wash my hands and
Go ahead and I'm
glove
gonna
up.
unclamp. 3 more ml. It flushes fine. My client has tolerated it well. Clamp it back. I would clamp it after I flush the last half ml. I would clamp it simultaneously.
Clamp this off.
Dispose of
I'm
this.
going to
Now I'm going to document it.
unscrew this.
Document
I'm
which
gonna
medication,
alligator
then my
clamp this,
administration
dispose
on my
of the
MAR.
open.
I'm going to record the time of the
Hang
start
it
and
up.
finish.
I
The condition
am
of the
at this
site,
point
it's
going
patent, it
to
went in nice, there's
pull
no
off
swelling,
my
no
needle
tenderness,
and
my
put it in the
patient has
sharps
no
container,
complaints.
attach
I'm going
my
to record the
saline
volume,
flush.
so he has received approximately 102
I'm
mLs
going
of
to
normal saline
aspirate,
mixed
which I
with
have
2
return
mLs
of
of
blood. I'm
Flagyl, which
going
is
to
500 milligrams to fight
push
an
stop,
infection.
push stop, push stop,
And
push
that
stop,
is
push stop.
IV
3
medication
milliliters. As I'm
administration.
pushing that last little